Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Teaching lady wrote in, and I'm so glad you're here to answer this, Dr. Granpeesheh, wondering what the medication is for a 3.5-year-old that shows physical harm to others when denied access or told no. If ABA doesn't work to tame his aggression, what are our options?
Yeah.
But at 3.5, can we really say that ABA isn't working yet?
Yeah, no. I mean, I think that, here's my take on it. And I apologize because I know that it's very hard for parents when their children are aggressive. So it's kind of like you just want to fix as fast as possible. But I truly believe that, and let's start with this: aggression of any kind is not part of the diagnosis of autism. In fact, none of the challenging behaviors that your kids do are part of the diagnosis. They're just not in the diagnostic criteria. So hitting, screaming, biting, throwing, pushing, none of this is part of autism. So, I'll ask you, why do you think your child is doing these things? And the answer will always come back: they are frustrated and trying to communicate something. And so this is the same with any young child. If you think about it, why is it that as adults we don't tantrum, although some adults do tantrum? And why is it that 2-year-olds do tantrum? And the reason is because they can't find the words fast enough to express what it is that's making them frustrated or what they need to calm down. And that happens with our kids, just as it happens past age 2. So they just, they learn that if I want something, I will hit someone and I'll get it. If I don't want to do something, I will scream and they'll leave me alone. So I am a strong believer that those types of things are sign of frustration. Now, so therefore, the solution is to understand what the individual is trying to communicate and teach them a more adaptive way to communicate it so that they can get what they need, right? So like if you really want to get out of a situation, can I teach you to say out or time out or I need a break instead of screaming and hitting? If you really want access to something, can I teach you to just like give me a picture of it or point to it instead of hitting or pulling? So those are kind of the behavioral techniques. Now that being said, it is very usually at 3.5, the next part of what I'm going to say doesn't apply, because 3.5, the behavior hasn't really been ingrained, like we haven't learned yet. So it's possible to change it behaviorally. Sometimes though, we have children who are very, very sick, very ill. They have underlying medical issues that have not been identified or resolved. Perhaps some, subclinical seizures. Perhaps they have a very, very extreme sensitivity to light and sound. There's something else that's causing this irritation and aggravation. And I would like to find out what that is and see if I can treat that to reduce the frustration, reduce the anger, and so on. Risperdal and those types of antipsychotic medications don't really treat the cause. What they do is they numb the response. It's kind of like when you take Tylenol for a headache or Advil or something, you're not really identifying what caused the headache. You're just basically blocking pain receptors. And it's kind of the same thing when you take something like Risperdal. And I think the parent had written they're also taking clonidine. And clonidine,
and she also has written in, I'm sorry to interrupt you, but that he had a yeast belly and C. diff.
Yeah, okay. So C. difficile is very, very hard yeast to get rid of, and you want to deal with the yeast before you deal with anything else. I would not go the route of an antipsychotic like Risperdal. Clonidine is usually given for sleep. If it's not helping, get off of it, talk to your doctor and get something else. I mean, a lot of our kids do very well with just melatonin, but talk to the doctor about this and work on getting rid of the yeast. Yeast plays havoc with our kids. It's crazy what yeast can do. It's unbelievable. Like, you have kids that are just laughing for no reason, kids who can't sleep at all, kids who have severe inflammation in the gut, kids who have diarrhea 10 times a day, all kinds of stuff. And it comes back to yeast and a bacteria like C. difficile. You have to get those treated. So talk to, I'm not sure if it was the same parent who's dealing with a MAPS doctor, but if you're not, that is probably the best place to go. And they're all over the world, really. MAPS, Med Maps is their website. Also, before we run out of time, because we have a couple of people in Holland, I just remembered the name of the organization in Germany, and Holland being so close. These folks in Germany, it's called Knospe ABA, KNOSPE ABA, and they actually send BCBAs to other countries in Europe as well.
KNOSP?
Knospe, with an E at the end, yeah.
SP.
KNOSPE ABA. Yep, there you go.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time on autism-network.com. We hope to see you there.